Thank you for joining us today. At Achieve a Family Trust, you may know we serve individuals with all disabilities, as Patty mentioned, intellectual, mental health, and physical disabilities. In planning for this webinar, it occurred to us that one of the areas that we have not provided specific information on is how to access services and resources for people who really present with primarily physical disabilities. And as we were planning this webinar, what we came to learn also is that this information isn't always readily available to people. So today we're really pleased that the presenters that are part of this panel are going to be providing an overview for how to enroll in services and supports for community living for individuals with physical disabilities, and also how to then access the resources and the services that are out there, as well as also some tips about self-advocating for the services that are available to you. So with that, I would like to, and I'm pleased to present our presenters, Erin Leiden-Klein, who is the Program Compliance Manager for Service Coordination Unlimited with UPMC's Community Health Choices program. And she's going to be providing that overview about how to enroll in programs and what to expect in terms of service coordination, and really give you that information for entering the system. And then we have Rebecca McTaggart, who represents a community. She is a community engagement specialist with Community Living and Support Services, otherwise known as CLASP. And she's going to be providing information about what to expect in terms of how they go about determining the needs of an individual and support a plan that they may develop for that individual with some innovative approaches that I think will be of interest. And lastly, and not lastly, but certainly Monica Albert Still, who is a nurse, who is actually works with the Physical Medicine and Rehab Physicians Department with the Adult Spina Bifida Clinic at UPMC. And Monica will be, again, providing us with really, and with you, for some tips for how to go about thinking about services and advocating for those services for your needs. So with that, introduce Erin. Go ahead, Erin, and take it away. Thank you.
All right. Okay. Thanks again, Maria and Patty for and Achieva for inviting Service Coordination Unlimited to present. I'm happy to speak on their behalf. Service Coordination Unlimited is a really great company to work for, and I'm here today to speak a little bit about one of the main services that we provide, which is Community Health Choices. We're a vendor for UPMC, actually, and I'm going to talk about how to enroll, what that looks like, and what service coordination looks like. A little bit more about SCU. We are a statewide company. We serve individuals in all 67 counties, and we have offices in Erie, Butler, Pittsburgh, and Washington. And I'm going to be joined a little bit later by Kate Barton. She's the director of the Office of Developmental Programs at SCU, and she can talk a little bit about other. And today we're going to talk about how to enroll in services through what's called an independent enrollment broker. I feel like they made that term unnecessarily fancy sounding, but it's basically a company that helps people get enrolled. They do that job for the Department of Human Services, and the name of the company is called Maximus. We're going to learn about the role of service coordination, the key programs that are available, and the specific examples that we'll go through later. I did try to keep a focus on individuals with physical disabilities and how they might benefit in particular from the program. So first, let's go over what it is to say waiver. What does that even mean? And then how Maximus helps with getting enrolled. A waiver is the term that some people, especially those who've been around in the field for a while, they kind of use it interchangeably. So when they say waiver program, they could mean community health choices. They could mean the adult autism waiver. It just kind of depends what background they're coming from. But what does it mean? Why do we use the term waiver? We use the term waiver because it allows states to waive certain rules about how they can spend Medicaid dollars. So typically, historically, Medicaid funds were used in this context for services inside of an institutional setting. What we call waiver programs, they waive that rule and allow dollars to be used to deliver services in the home and community-based settings. And a couple of examples of services, and this is just a couple: assistive technology, support for community participation, interpretation services. And all of those services are meant to promote independence, inclusion, and access to community and employment, just participation in all things life. And if there were a few 2025 updates that expanded coverage for individuals in acute care settings, some updated minutia regarding assistive technology evaluations, and then the addition of American Sign Language services for certain waivers. And then there's a lot of information on here. I really just wanted to point out that the community health choices waiver has, of course, certain eligibility requirements. The main one I wanted to mention is that it's for adults who are 21 years and older. And these slides will be shared with you later so you can take a more deep dive into this particular information. I just wanted to mention that main point. And also that there is another similar program for adults who are 55 and older called the LIFE program. That stands for Living Independence for the Elderly. And that's kind of like a one-stop shop, everything under one roof program that also offers some supports for adults with physical disabilities. So, but I'm mainly going to be talking about community health choices because that's my wheelhouse. So now that we know what a waiver is, we can talk a little bit about what is involved in the application process and what you can expect from that. There's really, really good information online at this PAIEB.com website. It's the Pennsylvania Independent Enrollment Broker. It's a Maximus website. There's really good information on there, and I think it's pretty easy to navigate. But I just wanted to just mention briefly that, again, Pennsylvania contracts with Maximus for its independent enrollment broker services. They've been doing it for a while, but in preparing for this presentation, I noticed a news release from last year. In 2024, Maximus was awarded another 5-year contract by DHS for $263 million to manage applications and enrollment. And I think I think they're doing that for more than just community health choices. And they apparently work in other states as well. They're a pretty big operation. So the application with Maximus starts with what's called a community referral form. And I'm going to show a few little snippets of what that enrollment form looks like. It's just a one-page application. It's really simple. We will include the application when the slides and other information are shared after the presentation. But I just wanted to kind of highlight a few points on here. A family member or a representative can actually submit an application for someone else. So the individual can, of course, apply on their own and refer themselves, or a family member can do it with the person's permission, of course. And then the Area Agency on Aging and the LIFE program, those two agencies can also submit an application on behalf of an individual. So if you already have a relationship with either of those two programs, then they can assist. In reviewing this and preparing, again, I noticed that since other people in your life can submit this application on your behalf. That does sometimes happen, and it sometimes results in individuals getting signed up for the program who really aren't interested. So sometimes folks will make it all the way through this application process and end up over with us at CHC, and they'll tell us, oh, my daughter applied for me, or my power of attorney applied on my behalf, and I'm really, really not interested. So obviously you're going to want to work with um, the individual and make sure this is really something that they want to do. Once the application's completed, you don't send the application right away over to the enrollment broker. You actually have to send out like an initial greeting so that they can open up a secure email portal so that you can send, because this does have protected health information on it, has people's birthdays and social security numbers. So we want to keep that information protected. So you have to first reach out. They'll send you information on how they want the information sent so that it can be sent securely. And then once the application's submitted, you'll hear from someone at the independent enrollment broker within a couple of days. They'll reach out by phone. And just wanted to mention again that a couple of things on here that I thought were worth noting. The kind of like the foundation of eligibility for the waiver or community health choices, as we call it, having medical assistance, and that is through the county assistance office. So if that is something that you already have established, that's great. If it isn't, then part of this enrollment and application process will be working with the county assistance office and obtaining medical assistance. The second piece I wanted to talk about is the physician certification. This is something that really should be done at the initial stage because the enrollment broker is looking for your doctor to indicate your level of care. So what does that mean, level of care? Well, in this application process, there's two choices for levels of care. Let's see. And I apologize for the alphabet soup with all of these acronyms, but there's nursing facility clinically eligible, and then there's nursing facility ineligible. And sometimes those terms are not, they're just, people like to avoid nursing facilities. So sometimes when you mention that a person needs to be nursing facility clinically eligible to be in this program, it makes people a little nervous because it just, people just, the term nursing facility gets people worried. So, but in this context, remember that we're talking about that waiver. So what we're looking for is, historically, maybe these services would have been provided in a clinical setting, but now they can be provided in the home and community. So what the program is looking for is that the individual is diagnosed with a medical condition or a disability, an illness or an injury, and as a result of that needs a certain level of care. So the physician needs to indicate that the individual is nursing facility clinically eligible on this form. If they select nursing facility ineligible, that kind of puts a stop to the application process. And that's not to say that there aren't other services and supports available in the state of Pennsylvania, but for community health choices, you do need to be what we call NFC. So that's why I suggest getting that form in the beginning of the process and not waiting until the end, just so that you kind of just doing things in a logical progression. So once the community referral form is submitted and you get your phone call from the IEB, they will schedule what's called an initial intake meeting. And that will be with a person called an enrollment specialist. And it can take place in your home or in a public space like a library, Panera, wherever you might want to meet. And they can have a conversation with you about whether the waiver program is right for you. And they can review what the paperwork requirements are and help you know what you need to gather. If needed, help you communicate with the county assistance office regarding the medical assistance application. So once that initial intake meeting takes place, then you can move along to the next step, which is an eligibility assessment meeting. So there's a couple of things that happen at this next stage. You get moved along to there's an assessment called the functional eligibility determination. It's the FED, the Fed. The Fed assessment looks at what your needs are and if your needs match up with home and community-based services. So a representative from the Area Agency on Aging will complete that Fed assessment. And then this second meeting is also your opportunity to choose which company you want to work with. And those companies are called managed care organizations. I try to simplify it a little bit more. You're basically picking your health insurance provider. So you're right now in Pennsylvania, there's three options. There's UPMC, AmeriHealth, or PA Health and Wellness. Those are the three insurance companies that are offering the Community Health Choices program. There was recently a request for proposals, and they're opening it up to more organizations to offer. But right now, these are the three that are doing it. But we will see in the next year or so a few more added to the mix. So once and there are other things that happen at this meeting as well, but those are the two main points I wanted to cover. So once the Fed is completed and you choose your MCO, then you can AAA pushes your paperwork onto the IEB to review it. So and all of your paperwork gets sent to the IEB/Maximus to get reviewed. And what can happen here is that maybe in your functional eligibility assessment, maybe it's determined that you don't really have a lot of needs and you're not eligible. So it could go either way, but usually by the time you get to that point, they're trying to work to help people get into the program. So the IEB will look at that physician certification and the Fed assessment together to determine your eligibility. And if you're eligible, then the IEB will forward your application over to the county assistance office, and it moves along to the financial eligibility criteria for the program. And for that, the county assistance office they take a look back period of 60 months. So that's 5 years. So they look back 5 years at your financial information. And there may be questions about the financial stuff that I can't really answer, because once folks get over to my side of things, the service coordination side, they've already done all of this stuff. So they come to me fully eligible and enrolled. So I kind of pick up at that point. So I can't really answer questions about the financial guidelines, but in general, I can give a couple of observations because, some people make assumptions about eligibility, and I can just related to the finances. And I can just say that I've observed all kinds of different situations over the years of people who've been in the program. I have had participants with full-time professional jobs. I've had participants in grad school, participants working on their PhDs, undergrad, people enrolled in CCAC. I've seen people who have part-time jobs, people who have part-time jobs and also volunteer, who are very active on nonprofit boards, people who act in community theater. I see people who have all kinds of different levels of employment and involvement in the community. And in terms of, what assets people have, I've seen people who, own their own home, have a car. I've seen people who have no income at all. I've seen people who are supported financially by their parents. Again, the whole gamut of income. I've seen it all. But in general, the information that I was able to find online indicates that the monthly income limits are around $2,900 for an individual. And then they do also look at assets, and assets need to be at around $2,000 or less. And what do they mean by assets? They look at bank accounts, obviously, stocks and bonds, real estate that goes beyond a primary residence, life insurance policies. Those are some examples of assets. And then they exclude some assets from the process. So an individual's primary residence, again, that's excluded. one vehicle is excluded, your personal belongings, certain burial funds. Those are the types of assets that are not included when they're looking at asset limits. And then they also allow individuals what we call a spend down. So if someone does have assets in excess of the limits, then they do give a period of time in which the individual can spend down on their assets. And that could include transferring assets into a trust or some kind of like annuity. That's the limit of my knowledge about that stuff. The county assistance office is really a good place to ask those questions. They're the experts. So all of that, from that referral form all the way to the end, where they review and notify you of the decision, should take less than 90 days. So from the start of application to the notification of the decision, it's 90-day period. They'll send a notice to the individual and to the IEB and to the managed care organization. Like, you know, if you chose UPMC as your MCO, then UPMC would get notification that you are enrolled. And if you're denied, there is an appeal process. And again, you'll be able to check out these hyperlinks later. I did want to just point out, I gave them a little gold star here. I thought they had amazing, detailed, but not overwhelming information on the process. I thought it was really interesting. I could have spent a lot longer checking out what they had on their website, but this Medicaid planning assistance website is really, really good. So they got a gold star from me. And if you're interested in finding out more, I would go there and check it out. Okay. So service coordination. Who are we? What do we do? How do we do it? What does that look like for you as an individual? So service coordinators are really, we're not a provider of direct services. We're not going to assist with meal preparation or, drive you to a doctor's appointment. We are really like a connector. We connect people with the things that will help them get what they need. So we're a degreed staff who either work directly for the MCO or we work for a service coordination entity. So that's what Service Coordination Unlimited is, where I work. We're a service coordination entity contracted by UPMC. So we're like a vendor for them. We deliver service coordination for UPMC. And UPMC does contract with a handful of other service coordination entities as well. And I have been a service coordinator for the other two, for AmeriHealth and for PA Health and Wellness in the past. I'm not sure how they operate currently, but I believe the MCOs are supposed to have some degree of choice so that the individual can choose, if you have a particular service coordination entity that you prefer, that you as an individual have that right to choose your provider. And again, we're the primary, connection point. And oftentimes service coordinators have experience in other areas of human services. So we have people who have been social workers, people who've worked for the county assistance office, who've worked for AAA or a nursing facility or a hospital. And it's really nice that we have this mix of professionals who have vast and varied experiences. So, we rely on each other. If we have a nursing facility question, we know who to go to among us to ask that question. So it's nice that we have a bit of a mix of work experience among us. Okay. And what are we going to do when we interact with you as as an individual? What can you expect the relationship to look like? So the main sort of meat and potatoes of what we will do with an individual is called a comprehensive needs assessment. So we do that in person. We conduct assessments which is really just information sharing and conversation. It's not anything to be intimidated by. It's just it's a tool that we use so that we can make sure we address people's needs. So we conduct this assessment once per year with the individual, and we talk about medical, behavioral, social, and long-term needs. We talk about diagnoses, what your health status is, what your personal preferences are, and what your goals are, and how you think we can help you achieve those goals. And we also talk about barriers to achieving those goals and any current gaps in services, and we figure out ways around those barriers to get people what they need. I like to say that the assessment is, I mean, it's really driven by input from the participant, from the individual, but it's a combination of clinical information, observation of the individual as well as their living environment, and then just, conversation. It's those three pieces that kind of support the information that goes into this needs assessment. And we take all that information and we, through talking with the individual and what their goals are, we develop this, what we call person-centered service planning. So we taking, take what the person's goals are, what their preferences are, what their needs are, and we just put it to paper, coming up with goals and interventions to help them meet the goals. Some people like to do that planning one-on-one with the service coordinator. Other individuals prefer to have someone else present with them, whether it be their spouse, their child, a legal guardian. It just depends on what the individual situation is. But you're welcome to include anyone you want to be a part of your care team. And we think of the service plan as being kind of like a living document. It grows and changes and gets updated over time. We hope that people meet their goals. We hope we can, check something off and say, she did it, he did it. They achieved this goal, and then we can put in something new. Some goals are ongoing. Perhaps the need for personal assistance or a caregiver, that might be the type of goal that is going to, continue to be a need for the duration. And part of the title service coordinator, what are we coordinating? Well, it's sort of like two things. We're getting the person in touch with the services that Community Health Choices provides, and we're also looking at what they might have outside of that, and we're putting it all together. So, you might have Medicare, you might have a behavioral health provider. You might already be working with a community organization like CLASP in some way. We kind of look at all of the resources that you're currently using and how we can address unmet needs through the 30 some services that Community Health Choices provides. And we help, again, because we think of planning as being something that's always like kind of moving forward, usually sometimes back, how life is. Sometimes things move backwards too, but we kind of like, take that ebb and flow and update the service plan as we move along. And another big piece of what we do is advocacy and support. We help individuals advocate for themselves, and that looks differently depending on the person and their support system and their own capacity. So we see a broad range of needs here with how well people are able to advocate for themselves. And a lot of external forces impact an individual's ability to advocate for themselves, whether it be behavioral health needs, just their history with accessing resources. They could have developmental or intellectual disability in addition to a physical disability or chronic illness. So people's ability to advocate for themselves varies. So, sometimes, I have a person who just needs a cheerleader. He is excellent at advocating for himself, and he just really wants to tell me about it. So he, so he does. And I, tell him, I very rarely have any other ideas. He's thought of everything and done everything that he can do, but he likes to get that little bit of encouragement. And then other people need more support, including just transfers to different settings as well. Sometimes we're helping people come out of a facility. Sometimes we're helping people use temporary respite stay while maybe their home environment is getting worked on or their support system is traveling or something like that. So we assist people with transitions as well. And how we do this, I kind of touched on the assessment process already. So that is done in person at least once per year. And we are also required to have a certain number of phone contacts with individuals as well. And we are also required to follow up on emergency room and hospital admissions, and to closely follow up on other types of incidents, like any involvement with adult protective services or, if there's some kind of abuse happening, anything that happens like that, we are reaching out more frequently and having more contact. And the caseload size for a service coordinator right now is between like 50 and 70 individuals. So we're doing this required schedule of contacts for a lot of people, which kind of brings me to my next slide, which is the importance of participation in the program. For community health choices, we do refer to individuals as participants. We do expect, well, the participant is agreeing to participate. So it's not just a one-way flow of information and communication. The individual is required to participate, be responsive to phone calls, the willingness to allow an SC into your home, sharing personal information. All of that is a part of the program. Some aspects of that may be more difficult for some people than others, but it is required. I like to think of this comparison. If you have an appointment with your primary care physician and you decide not to go, your PCP isn't going to call you and then stop by your house, then maybe call again and send a letter. That doesn't happen, but with us it does. So we will make those calls. We do have to do what we call pop-in visits. We will send a letter. We will, we have to do our due diligence to ensure people's health and safety, and that's why we do it. So that's just another expectation for the program is that participation. And I wanted to talk a little bit about how we've worked with individuals and given them what they need, what they've told us that they need through the service planning process. I have so many examples, but I thought I would give one for home adaptation. Home adaptations are one of the 30 some services through the program. And I have a person I'll call John, hadn't taken a shower in a long time. He wasn't able to get from the wheelchair into a shower. So he utilized the home adaptation service and had a barrier-free shower installed, allowing him to shower for the first time in years, which, that's one of the really happy points of being a service coordinator, is being able to see someone obtain something that gives dignity and really helps with an essential part of just day-to-day living. So seeing that was really special for me. I have another example for assistive technology. That's another one of the CHC services. We have a participant, we're going to call him Greg. He became disabled following a severe car accident and lost his capacity to speak, but he still had the ability to communicate. He just needed a bridge between what was happening in his head and letting other people know. The Community Health Choices program, through an assistive technology provider, purchased a tablet for him that allowed him to communicate using pictures and frequent keywords. And it's just been a real game changer for him and for his caregivers and family and support system. For personal assistance services, I wanted to talk about my participant, Patty. She is someone who was born with cerebral palsy. Specifically, it's spastic quadriplegic CP. And she does have use of one hand. She can operate a smartphone. She likes to do different crafts. She's really super independent. She utilizes personal assistance services in my favorite way. She has a caregiver come in the morning to assist her with getting ready for the day. And then the caregiver, after Patty is set up in her power chair and has her food for the day kind of accessible to her, the caregiver leaves and Patty goes on and goes about her day as anyone would, doing the things that people do, going to appointments, meeting friends, going to the library, whatever she's got on her agenda. And then a caregiver comes again in the evening and assists her with winding down and getting ready for bed and getting into bed and helping with those transfers. So I feel like that's a really just excellent example of supporting independence. And then this last one, the repairs to equipment, I feel like this is it sounds so mundane because, we all deal with having to keep the things we use operating, whether it's your vehicle or your refrigerator or your washer dryer, whatever. I mean, those are just like the mundane things that adults have to do. But we need those things to work, right? Well, when you might have a physical disability, you need other things to work, like maybe your lift chair or your power wheelchair or your ceiling lift or your stair glide. All those things are great, but only if they work, right? So Community Health Choices does support ongoing repairs when needed. And then I also wanted to take a minute to talk about CU in particular and how we support our participants. We have something called the Community Spirit Fund, and this fund is primarily supported by our own employees. So we, as employees of SCU, donate money either at a few special times per year, or maybe we have a little bit that we give every paycheck, but we donate these funds to support our participants with needs that can't be met. Because the Community Health Choices program is really great, but I mean, it's not everything. It is health insurance. There are going to be denials for certain things. So I have a few examples of things that we've assisted with because there's been those gaps for people. For instance, a woman we'll call Diane. This was a shower chair and I see this happen all the time, unfortunately, with shower chairs specifically. Her primary care doctor wrote her a script for a shower chair and she got it. And because of the weird shape of her bathtub and the space in her bathroom, it didn't work, just didn't work in the space. It wasn't level. It wasn't safe to use. She couldn't use it. And her PCP tried to help her get another one, but insurance denied it. And she was told, okay, well, you can ask for another one in 5 years. So very frustrating experience. And her service coordinator helped her apply for funding from the Community Spirit Fund at SCU. And we were able to get her a swivel seat shower chair that worked in her space. And I think it costs like $87 or something like that. She had been showering using like a sponge bath method just at her sink because she couldn't get in the shower. And this was another example of just giving people independence and dignity with a day-to-day task, right? My next example is another just small amount of money that made a big difference for someone. We have a guy we'll call Dan. He uses a power chair to get around. And his sister likes to take him all over the place, anywhere he wants to go in the community. They put the Community Health Choices did pay for a vehicle modification. That's another of the 30-some services is vehicle modifications. And they put a hitch and a trailer for the power chair on the back of her SUV. But what they found is that if it rained or just, even driving on the highway with this thing, like rocks and stuff would get kicked up and put little nicks in the chair, or the chair would get wet, or there would be snow on it by the time they got somewhere. So the Spirit Fund was used for a cover to go over it. Kind of a mundane little thing, but it really made a difference for them. Protected his very valuable piece of equipment and made it usable for when he got to point B. His chair was dry and clean and ready for him to get in it and go places. And then the last example is a specialty mattress was purchased. We have a participant, we're going to call her Judy. She was denied a specialty mattress that would help her prevent skin breakdown. She just didn't meet whatever health insurance was requiring to get a gel mattress. She didn't meet the criteria, but she did nevertheless have problems with skin breakdown due to being mostly in her bed. And she got a gel mattress through the Community Spirit Fund. And of course, that's helped to keep her skin in good condition. And I just put our resources in again. There's good information about Community Health Choices, and you can actually look at a list of what all of those 30 some services are. You can check that out. And then again, our Service Coordination Unlimited website as well. And I'm going to pass the baton over to Kate.
Yes, hi, my name's Kate. I'm the director of our Office of Developmental Programs Department at Service Coordination Unlimited. So I'm primarily dealing with folks who have intellectual disabilities or autism, but have worked in CHC under every MCO, as well as our OLTL department. So we'll be delving into some of the other options for waiver. So to try and break it down as clearly as possible, DHS is broken up into two kind of facets. So there's the Office of Long-Term Living, and then there is the Office of Developmental Programs. Now, the Office of Long-Term Living is what Erin has gone into, encapsulates a CHC, but there's also a few other waivers that are available to folks, including the OBRA waiver, the LIFE program, as well as the Act 150 program. And really the differentiation between those waivers and CHC has to do with either age restrictions. So OBRA is for folks who are between the ages of 18 and 59 and have either a physical disability, but they can also have a developmental disability. There's just some diagnoses that aren't, included, but it's, designed as well to help them live independently with some aspect of support. The LIFE program Erin has gone into, but it just kind of gives you all that necessary support for medical and social services, and ensures that. And then lastly, under OLTL is the Act 150 program, which is a state-funded program. And it's similar to a waiver, except it's often selected for folks who do not meet the financial criteria or eligibility for Medicaid. So in place of receiving Medicaid services, they are required to pay, it depends on the agency, but some type of fee that's determined on all of their income, assets during what's called a fee determination, which is conducted yearly. So once that's completed, they will then have to pay that fee either biweekly or monthly for a full year until that next assessment is completed. And then there is also another waiver for infants, toddlers, and families, which is the Infant, Toddler, and Families waiver, which is more so focused on early intervention. So then the piece of the waiver program that I work in under the Office of Developmental Programs is exclusive to IDD, intellectual disabilities, and autism. And there's different waivers under there's different waivers under the ODP department and program, but all folks come in under what's called supports coordination only or base funding. So the reason why we kind of wanted to break off into ODP, as it is under a different branch of DHS, is because sometimes we have folks who have both IDD or autism as well as a physical disability. People can't have multiple waivers under DHS because it's considered to be utilizing funds more than once. Oftentimes it's referred to as what's called double dipping because they're Medicaid services, or folks have to at least remain Medicaid eligible for anything considered a waiver. There are programs that do not require Medicaid eligibility, but the waivers themselves that are backed by funding do. You can do the next slide, Erin. So we wanted to help explain how to know which program fits a participant's needs. So in all actuality, you can have both CHC and ODP services. However, the services that are available to folks who already have a CHC waiver is exclusive to that supports coordination only / base services because they don't utilize that Medicaid funding. They don't necessarily even receive services. Supports coordination only is truly only supports coordination. So we help with finding resources in the community and getting them connected with resources. There's nothing that the county or the state is actually paying for in terms of services. So it is possible for supports coordinators and service coordinators to work together and ensure the participants' physical and intellectual supports are both being met. There's just some limitations there. So if a participant does require a higher level of need that would warrant a waiver versus one of the smaller programs that's not funded and there's no budget, they can't have both programs. So it's important for our folks to know how to determine whether their physical disability or IDD, autism diagnosis, is more prevalent in their life and the implications it has on their ability to remain independent. And sometimes it gets a little muddy because there's two different processes for enrolling. So you can't necessarily just go to the IEB or Maximus and say, this is my situation, what program should I get? Because enrollment for ODP happens through the county. So it's through an administrative entity that they oversee the participant from intake through the program, but it's not like the IEB satisfies both programs. So the participant has to ask themselves, if my diagnosis of IDD or autism is more severe than my physical disability, which program makes more sense? We generally would most likely say ODP would make more sense in that case, and vice versa, but also trying to help on either side fill that gap and see what types of services might be available to satisfy the absence of the other. So what community resources or what things can we put them in connection with in order to ensure that both the physical and intellectual side of their needs are being met. So then this is just essentially a breakdown of all of the acronyms that we use generally on a day-to-day basis. And this surprisingly is a small little bit of it, but that'll be in the slide as well. And it just breaks down anything that's in bold throughout the PowerPoint in case you need further understanding or explanation. And then this is our QR code for SCU, which will take you to the website. And there's different pages explaining the different programs and how you can reach out to us if you need assistance.
Thanks, Kate. And I think that is everything. And thanks again to Achieva for inviting us. I hope everybody learned a little something today.
Thank you, Erin and Kate. And we're going to ask Rebecca to give us information about CLASP services.
Yeah,
What's available?
absolutely. So good morning, everyone. First, I want to extend a huge thank you to Achieva and specifically Patty and Maria for giving us the opportunity to share a bit about our amazing work and what we do and why we do it. So as you guys know, this is focused on people with physical disabilities, and my presentation will reflect that. However, CLASP does proudly serve individuals with a wide range of disabilities. So if you are curious about those programs, please don't hesitate to reach out to us and get more information after the webinar. So CLASP's core belief is that everyone belongs. And as our slide states, we support people as they explore options, participate in the community, and strive toward equality. We are working towards a community where each belongs. Next slide, please. So first, a little history. Imagine being told that you, your child, a loved one, didn't belong in your home or didn't belong in the community, that they belonged locked up in an institution. Well, in 1951, a group of clinicians, educators, medical professionals, and of course parents, because let's face it, parents can be a child's fiercest advocate, pushed back on this idea, establishing a small diagnostic clinic for children with disabilities. Later, that clinic would evolve and grow into what would later be called CLASP, or Community Living and Support Services, in 2013. Next slide. So today we serve over 500 individuals directly through our programs and over 1,200 indirectly through our comprehensive programs. We actively seek to strengthen networks and relationships that will ensure individuals have access to the tools they need and that they are connected. So everyone has something to offer. You, me, everyone. All people have gifts, they have talents, and they deserve to play a vital role in the community. And one of the coolest things I like about CLASP is that our programs do not have to stand alone. They can work in concert with other services here at CLASP, or even services and programs outside of CLASP. And next slide. So we don't start with a preset plan. Instead, we collaborate with participants, keeping several key areas in mind to ensure that the plan truly reflects their person, their unique needs, and their aspirations. So when co-creating services with individuals, we always consider their goals and their desired outcomes. And this isn't just about your day-to-day tasks, but it is about their vision of what a fulfilling life looks like for them, both long-term and short-term. So we also look at what are their strengths and their preferences and, what they really enjoy doing. We also look at their health and their wellness. What are their medical needs, physical and emotional needs? And so we want to support their overall well-being. We also think about community and social connections. Who are the important people in their life? Their family, friends, mentors. How can we help them build and maintain those relationships and possibly make new ones? We like to ensure informed choice and decision-making, providing information in an accessible way so that they can truly make informed decisions. And of course, we always think of the risk factors and the safety planning, but we don't want anyone to feel like they are wrapped in a bubble. Next slide. So we have our in-home services, which are central to how CLASP provides support, direct support. And here we assist people with their instrumental activities of daily living, their IADL, like managing medications or preparing meals, and their activities of daily living, or ADL, which are essentially self-care tasks such as bathing and dressing. Said it before, this isn't just a one-size-fits-all approach. It's a collaborative effort, and you hear that a lot, between CLASP, our dedicated staff, and most importantly, the participants themselves. Funding for our in-home program comes from community health choices, private insurance, there's a self-pay model, options program, and Act 150. And as I spoke to you about, you're going to hear about collaboration a lot. An example of that here is Mike, who participates in one of our transition housing options through our residential program. He also receives in-home services that are tailored to help him develop independent living skills. So one day he can live in his own apartment. So, and as a side note, because I always like to talk about the cool things people like to do, Mike loves playing the guitar. And if our staff are lucky, they get a chance to hear him perform. And that's really cool. Next slide. Then there's Anne, who is an avid moviegoer and social butterfly. Anne's support is another perfect example of our blended approach, involving both our in-home services and our multiple sclerosis exercise and support program. So through close collaboration, Joyce, with our MS program, helps Anne maintain strength with weekly exercises, while Vicki, her direct care worker of 13 years, provides quality care and helps Anne plan community outings. As Anne says, the MS exercise program has helped her to relax and helped her to feel better. Because truly, let's face it, I don't want to go and socialize and do the things that I actually enjoy if I'm just not feeling good or I'm feeling down. So this was nice to hear. And funding and support for our wellness programs come from grants, either the individual received or our amazing grant writer, Alyssa, obtained specifically for that program. It also comes from scholarships or donations, and of course, there's always a self-pay option. Next slide, please. So another home-based program, one that I touched on earlier, the residential program. We have 18 homes and apartments in Allegheny and Westmoreland counties, and excitingly, our 19th opens this Saturday, so it's really busy here at CLASP. Each apartment has 2 to 3 individuals, each having their own rooms. So here we have Russell, and after living in his family home for years, he decided he wanted to live in his own apartment through our residential program at CLASP. So to ensure a smooth transition, a team assembled to address his needs as a deaf individual through assistive technology. We hired a sign language trainer for our staff, and we hired a deaf individual to assist him and work directly with Russell, teaching sign language as needed. Through that program, he has become extremely more independent and is really enjoying hanging out at the casino and bowling. So I really think that is another successful team effort. So other services in residential, personal care, medication management, wellness and health, housekeeping, laundry, financial management, and 24-hour support. And funding for individuals for that comes from community health choices, private insurance, and trust funds. Next slide, please. So beyond in-home support, CLASP also offers day programs, including our structured day program. This is specifically designed for individuals with brain injuries and other neurological conditions. These programs are all about fostering engagement and continued growth and independence. We help them with financial management, safety awareness, health management, all focused on a successful reentry to the community. So on this slide, you'll see Nino, who has a true passion for making music as a DJ. After his brain injuries, this became a significant challenge, but with the dedicated support and talents and help of one of our staff members, they were able to make the music platform and technology that Nino loved accessible for him once again. In fact, Nino is becoming quite famous in the Pittsburgh area. His story made the news, and he is set to perform at Disability Pride Pittsburgh on September 20th in Schenley Plaza, so make sure you're there. And I really think that Nino's story truly exemplifies how our day programs really support the individual to pursue their passion, overcome challenges, and thrive within the community. Next slide. So moving into our community programs, we have a unique Community Partners Initiative, which is designed for individuals who come to us with a very specific personal goal they want to achieve. Now, this goal may evolve as their time in the program progresses. So instead of a long-term service, we connect them with a carefully chosen community partner who can help them reach that specific objective. Once that goal is achieved, the direct support typically phases out unless the individual identifies a new goal they want to pursue. This is a partnership model. Staff guides the participant toward their desired goal, and staff won't complete the goal for them. So, for example, when Kylan met his community partner, Peggy, he had been living without running water for 2 years due to some landlord issues. So Peggy immediately stepped in. She helped Kylan navigate legal challenges, connecting him with neighborhood legal services, and ultimately finding a new and accessible apartment. Kylan was overjoyed, especially for his first hot shower in his very own apartment. He shared with us that they helped me find my new apartment to live in, which I really like, and it has running water. So now Kylan is thriving. He's building friendships with neighbors, and continuing to work with Peggy on new goals like exploring job options. So the support and funding for that program comes from Community Health Choices, our Human Services Development Fund. There's also a self-pay model. Next slide. Our supported employment program is designed to help individuals with disabilities prepare for, find, and maintain competitive employment that aligns with their skills and their interests. We provide personalized support through skill exploration, skill building, resume building, interview skills, job simulation, self-advocacy, and long-term coaching. And though this is meant to be phased out, we want to ensure that success happens in the workplace. So if things change, we'll step back in. For example, Aiden was ready to transition to the world of work. And through the guidance of OVR, he connected with us and he discovered his strengths were in a quiet, organized setting. And while his tech skills seemed to fit an IT department, it was in the library that Aiden truly found his calling. He was sorting books and immersing himself in knowledge, and it ignited a spark. He began his employment at the library, honing his job skills and earning an income. Again, Aiden's story shows the power of exploration and finding a career that actually aligns with one's true interests and skills, leading to fulfilling and rewarding employment. Support and funding for that program is through OVR, Community Health Choices, self-pay, and private insurance. Next slide, please. Now, I would be remiss if I didn't highlight our wonderful Firefly camps and retreats. These programs provide accessible and inclusive opportunities for children and young adults with disabilities. They get to enjoy a traditional camp experience while learning new skills and building on old ones. It is really a chance for participants to make new friends and build confidence. Noah, who you see here, has attended Camp Firefly for over 10 years. He loves the camp for its diversity and camaraderie. He says that every summer I look forward to meeting new people and reconnecting with old friends. Noah feels fully supported by our staff, who ensures he's comfortable and treated with respect. The camp has significantly boosted his confidence and his independence, helping him build long-lasting friendships and learn to do things on his own. Noah calls it his home away from home. He encourages everyone to, quote, "Please come. You'll have fun, meet new people, and try things you've never done before." Now, it's important to note there is a separate camp and retreat for age groups, and the funding and support for those comes from camperships and donations. It's also grant funded, and there is a self-pay option. Next slide, please. CLASP also has comprehensive programs that can be utilized whether you're a participant or not, like TechOwl. TechOwl's mission is to help Pennsylvanians with disabilities, older adults, and their families acquire and use assistive technology. TechOwl provides a wide range of services, including device demonstrations, short-term loans of equipment, there's a use and reuse program, and also information and referral. We also have a 3D printing program, and you can find more about that on their website. You know, it's all about bridging the gap to accessibility through innovative technology. And an example of that is Becca, who runs our assistive technology department, helped a gentleman who wanted more independence at home. Through TechOwl, she helped him implement smart home technology. Now he can easily turn his lights on and off, play music, control his TV, and so much more, all without waiting for assistance. You know, this simple change has made a huge difference in his daily autonomy and quality of life. Next slide, please. So our information and referral service is a vital part of my role here at CLASP. We are committed to the broader community. And I have to say, it's more than just a Google search. Our approach involves truly connecting with individuals and organizations that provide us essential resources. We build relationships and verify the quality of these resources so that when we connect someone, we know they're getting reliable, effective help. I also try to follow up to ensure they received the assistance they were looking for and that their needs were met. Now, this personalized approach ensures that no one is left without the information and support they deserve. In fact, on the side, I volunteer for the Montour Trail. And through my relationship with them, CLASP was connected with an avid trail user until her disability made that impossible, or what she thought was impossible. She was thinking of getting a scooter for the trail. She shared she was disappointed, though, because she really liked to exercise. So when I suggested trying a hand cycle, she excitedly shared that she never thought of that and really didn't even know that was something she could try. So she was connected to several reputable providers and information for potential grants. And I really, really look forward to hearing about the outcome, as I love the trail myself. Next slide. So at CLASP, we strongly believe in collaboration over competition. We actively partner with other organizations, both for-profit and nonprofit. We want to provide comprehensive education and resources to the whole community. This collaborative spirit ensures that individuals receive the best possible support, leveraging the strengths of many. We have had several successful examples of these partnerships, like 412 Ability Tech. So this initiative collects disability organizations, schools, and the broader community with assistive technology providers, ensuring broader access to crucial tools. We also work with Bridging the Gap. This group is funded by the Ryan Sevier Fund and brings together a diverse organization that support people with spinal cord injuries. It's creating a unified network of care. We also work with the Alliance for Access to Assets, and this is led by the United Way of Western Pennsylvania, another collaborative effort to ensure people with disabilities have access to financial security and the ability to build their assets. One of our favorites here at CLASP is Beauty Beyond Limits. We did this for the first time in May, and because it was so successful, we're going to do it again. This incredible event featured Miss Pennsylvania and her adaptive beauty line, along with Miss Wheelchair Pennsylvania and Dress for Success. So connect with us on social media and through our newsletter, and I'll tell you how further down in my presentation, so we can let you know what that date is in May. We also have another event that we just started last year, and we're doing it again. Charting Your Course was with Mind Your Brain, and it's another success story. It's dedicated to helping people with brain injuries, their caregivers, and even clinicians and students learn valuable tools and access vital resources. In fact, I'd like to thank Achieva for letting us borrow one of your staff for our panel, Live, Work, Play. So mark your calendars for March 7th at Cohatch in the South Side. Next slide, please. So before I end my presentation, I want to make sure that you are aware of some things that you should have ready for our intake process to ensure a smooth process. So we have our intake diagnosis and disability documentation. You want to have your current medical records, a list of current medical providers, your insurance information, current service plans and contacts, goals, desired outcomes, your emergency contact information, staff preferences, because that is important, and a backup care plan, and there's more. So if you need more information, make sure you call us. You can talk with Celeste Miller, who's our intake coordinator, or me, the community engagement specialist, and our contact information is on the slide and will be made available. Next slide, please. So I know all of this is truly overwhelming. So we hired Trudy. She is our special AI employee powered by Skill Builder. Her picture is inspired by the legacy of Gertrude, who established the United Cerebral Palsy. She offers personalized guidance. She definitely has a comprehensive understanding of. So if, I've heard that parents, for example, love Trudy because, they work all day long, they come home, they take care of their family, and then at night they say to themselves, oh, I forgot to make that phone call. So they can just hop onto our website and Trudy can answer, most of their questions. Next slide. And as I said, connect with us on social media. We're on Facebook, Instagram, YouTube, LinkedIn, and we also have the CLASP Quarterly. So you can keep up to date on all the cool things we're doing and the events we are doing as well. Next slide. Now, I would like to thank Achieva again, and I feel so lucky that I get to, talk about what we do and present with Erin and Kate and Monica, who is up next. Thank you so much, everyone.
Thanks, Rebecca. Monica, take it away.
Okay. I'm Monica, and I am the nurse at the Adult Spina Bifida Clinic at UPMC Mercy Pavilion. I kind of bridge all places here. My background is in home health care. I have spent 30 years as a nurse in home health care, but I'm also a recipient of home health care. I have Act 150. I am a disabled individual. I was born with spina bifida, and so I see both sides. And what I want to talk about is what you do after you're approved and what you're doing, and you have people in your home and you have a program in place, and how do you work with individuals and how you advocate for yourself. Why is self-advocacy important? Well, it's important to me as a disabled adult because it's how I get what I need. It's how I tell people what my needs are and make sure that their goals are my goals. And when we talk about patient-centered or person-centered, excuse me, my age is showing there, person-centered care, this is what we're talking about. Setting our goals together and making sure you get, or the person gets, what they need and what they want. That's the most important thing to me. And as a nurse, effective self-advocacy, it improves care outcomes. You're going to be more engaged in your care and more engaged in your life if it's your goals, not someone else's goals that you're trying to do. So we're going to make those goals happen, make those outcomes happen, and move forward. And it also builds trust in a stronger relationship with your direct care worker, aide, attendant, personal care attendant. All those names, home health aide, they all mean the same thing. It is a caregiver that comes into your home that helps you live your life. And you are the person that is directing them to help you live your life the best way you can in the way you want to. Next slide, please. The important thing is to be prepared. Make a list of questions and concerns when somebody comes into your home to provide care, or when you're talking to a case manager or somebody who is helping you direct your care and figuring out what you need. Make a list of questions and concerns. Have them right there next to you. That's important because I don't know about you, but I forget about different things that I'll go, I should have asked that. Taking some quiet time and really thinking about what you want and how you want your life to be and writing that down, and how whoever you're working with, whether it's CLASP, whether it's CU, how they can help you meet those goals, how they can help you live your life and thrive instead of just survive. And prioritize the most pressing issues. Sometimes We can't do everything at once. I wish we could. It would be significantly easier in life if we could just say, okay, we can do all these things at once. But look at what you need the most. If your bathroom is inaccessible, then yes, prioritize that. Make sure that you can get into your bathroom or get into your house. Or if you need somebody to make you breakfast every morning, then that's your priority. Whatever is your priority, make sure that that's the issue that you talk about most. And that's the issue that you make clear that that's what you need the most. Next slide, please. Open and honest communication. That is so important. That is important in life. But when you are having people come into your home, it is your space, and you want to make sure that they're comfortable and you're comfortable. Given the shortage of direct care workers, it's important to make the direct care worker comfortable in your home and get your needs met and have your goals met at the same time. Best way to do that is through open and honest communication. Clearly state your needs and concerns. This is what I need you to do. This is what my goal is. Use I statements to express your feelings. If there's difficulty or, I don't think you are understanding this, not you're doing this wrong. There's a subtle difference there. When you talk in I statements, you're expressing your needs, your feelings, and not sounding like you're placing blame on the other person. You're saying, I need this. I need you to do this. And that makes the difference sometimes with how people listen and how people respond to you. Actively listening and ask for clarification. How many times have you played the game of telephone where one person says one thing, another person says another, and by the time it gets to the line, it's entirely different than what the first person heard? Sometimes that happens when we talk to people. So we need to listen very carefully. We need to hear what they're saying. And if we're not sure, for clarification, is that what I heard this? Is this what you meant? That's so important because this way we can have an open dialogue, talk to each other, and make sure that everything is good between people. Next slide, please. Also important is knowing your rights. Know your patient bill of rights. The term is patient. It really should be bill of rights for whether you're in the hospital, whether you're working with a home care agency, whether you're working with CLASP, whether you're working with SCU, no matter who you are working with, there are always rights that you have as the person receiving care. And that is important because you need to know what your rights are, what they should be providing to you, so that we sometimes have to remind people of what our rights are. And also to know our responsibilities. That's equally important. That is so important because you're showing that you're engaged. You're showing that you know what you want, but also that you know what your responsibilities are. You know what you have to do to get what you want. And also know relevant laws. That is important because the waiver process, I think all of us here knows that it is very confusing at times. And knowing what the law states and knowing what the requirements are, make it a smoother process for everyone. Participation. Participate in developing and reviewing your care plan. Don't just say, oh yeah, that sounds good. No, look at it. Look what the person is going to provide for you. And if that's really what you want, and then talk to them about it. And showing that you're engaged, showing that you know what you want gives you better care. I have seen it time and time again in my own care and also as a nurse. Think about this. If you go into something that you know what you want and you know how to get, you know what is needed, and you describe that to someone rather than saying, just give me whatever you think. 9 times out of 10, you don't get what you really need. You don't get what you really want. So being proactive and knowing what you want and need and verbalizing that is important. Know how to help contact your healthcare team in emergencies. I think that is vital in this day and age, knowing who to call about what and knowing what an emergency is. Sometimes we have different ideas about what is an emergency. Other times we know really well what is urgent. Of course, if someone's bleeding, if someone's not breathing, that's an emergency. Equally important is if there's a storm coming, a snowstorm, and my goodness, you need care for this day. You can't get out of bed without assistance. Well, you need to be able to contact your healthcare team to put into place your backup plan. Everybody should have a backup plan. There's no guarantee that someone can get to your house, but also know how to contact your team to talk to people about, gee, this is what's going on. Do you think I should go to the emergency room? Or do you think I should, wait to a doctor's appointment? Have a back and forth conversation with people. I keep coming back to speaking with people. The other part of it that's important is also knowing who to contact if you're having some difficulty with either your agency you're working with a person direct care worker who's coming in your home. You need to have open communication and respect. You need to respect the people coming into your home, and they need to respect you. You are the boss of your care. That is the most important thing. I am old enough, again, my age is going to be showing here. When I started in home healthcare and did some direct care work when I was younger, what I was taught was that I was a guest in a person's home and that my purpose was to assist them, to help them live their life, and ultimately the responsibility of what happened and how it happened and knowing what to do was not just the care plan that was in the home, but was the person talking to me, the person telling me how they want to live their life. Also provide constructive, non-judgmental feedback. You can easily say to someone, you know what, I think this works best for me. And as long as it's not safe, because that safety is always a concern for direct care workers, for nurses, we have to think of that all the time. And we do have to say, that maybe that's not the best way to do it, but work with them. Go back and forth, try to collaborate and come up with a plan that is safe and also is what you want. Boundary issues. It is so hard to maintain boundaries when you work with the same person who is coming into your home day after day and you get close to them. But you have to make sure that when they are doing their professional job, direct care workers are professionals. They're doing the job that they are paid to do. You are their employer for when they're in your home. So you need to address that. You can, of course, talk to each other about, baseball scores or what you're doing, or if you have mutual friends, if they're comfortable with that, if you're comfortable with that. Of course, we're people. We're going to connect on different levels. But when it comes to your care needs and what you need and what you want to do, you need to be that employer. You need to be that boss. You need to sit there and you need to say, hey, I need you to do this way. And it's also important to practice patience and understanding. Not every person who cares for you is going to do things the exact same way. That's just not how people work. And there are multiple ways to get the same thing accomplished. Not every nurse is the same. Not every nurse does like a dressing change the same way, but we have the basic understanding of what's safe, what's effective, and how to prevent complications from happening. And so kind of gently nudge and to make sure that, yes, you're getting your needs met, but understand that there may be a learning curve, that they may have worked for somebody that did things differently, and be a little bit open-minded. Maybe their idea is something that you can live with. Maybe it's something that's better than what you've been doing. So I think that is also important. Next slide, please. No matter what you do, there are people. There are almost always conflicts. It could be with your care manager. It could be with the agency you're working with. It could be with a direct care worker that's in your home. And sometimes it's hard for us to talk about conflicts and to be proactive and to respond in such a way that we can resolve the conflict rather than escalating it. I know when you're reliant on somebody to provide you services and they're in your home and it's just you and the person in your home, sometimes it's not comfortable bringing up issues or talking about, something you're displeased with or something that isn't working. Involve family or friends if needed. Have somebody come in and be your support. Have them not speak for you, but be there so that you're comfortable using your voice and saying what your needs are. If it's something that is urgent and very concerning, if you have a home health agency involved or your service coordinator, the other person you would contact would be your service coordinator, contact them with your concerns. Be factual, have the date, the time, what happened. This is what happened. This is what my need was. And I need this to change because I am concerned because, again, those I statements, and work with them to have a good solution to a problem that you may be having. Lastly, consider legal advice if necessary. There are different organizations that you can work with. The Pennsylvania Health Law Project is very good to work with if you're having difficulty getting services and speaking with them about this is what my needs are. I'm not understanding why I can't get them met. They sometimes give you some suggestions or they may help you move further. Disability Rights PA is also another organization that can give you some support, put you in the right area to look for help, to give you resources. And they don't rarely take on cases of individuals, mostly because of funding issues. But if enough people talk about a problem that is happening, they will do a class action suit. And then you see change for everyone. One of the examples that I have of that is where people weren't being medical assistance was not paying for temporary items that you need, like ramps on a house or stair lifts. And there was a class action suit. It was in the pediatric realm. And lo and behold, the judicial system decided that, yes, those are things that medical assistants should pay for. And not only did they do it for kids, the judge said, my goodness, we need to do this for adults too. So all these things, having people assist you, finding the right resources when things aren't going right, it helps. And it helps resolving conflicts. But the best way to resolve a conflict, of course, is on the individual level, not having to go higher up the chain. And hopefully that is what will happen. Next slide, please. My part is really short. Final thoughts. Be proactive in your care. Think about what your needs are. Communicate effectively and assertively. There is a difference between assertiveness and arrogance. Be assertive, be positive in yourself, positive what your needs are. That way you can get across what you need and make sure that you are the person in charge of your care and your life. Also, foster a positive caregiving relationship. It's going to make your life so much better. If you can work with your direct care worker, work with your care coordinator, and find that mutual ground where your goals are met, they're doing what they need to do, it's going to make things so much better. You are not just going to survive, you're going to thrive. I would like to thank Achieva for having me here today. Um, like I said, I have life experience and professional experience, and I hope that everyone gets what they need. And I'm going to turn it back over to Maria.
Okay. Thank you so much, Monica. I mean, this has been a terrific presentation, all of you that have provided so much good information about accessing services and what's available. And again, I hope that, people will take advantage of the services that are out there.
We're really grateful for the time and effort you put into putting everything together for us. So thank you very much. Just a couple of housekeeping items. As a reminder, this webinar has been recorded and should be up on our website, I would think by early next week. And our website is www.achievafamilytrust.org. If any of you have any questions for any of us here at Achieva staff or anything about this webinar, please don't hesitate to reach out and contact us. Some of the topics that the presenters covered, they were talking about, home and car modifications and different things like that. I wanted to mention that Achieva Family Trust does have a charitable residual program that's open to anyone in the state of Pennsylvania with any disability. So it can be physical, it can be intellectual, mental health, any kind of disability, open to anyone in the state of Pennsylvania under the age of 65. And the charitable grant program really helps individuals purchase things to help improve their quality of life that their waiver can't cover or that other insurance coverage will not cover. So we do a lot of home and car modifications, recreation, adaptive equipment, wheelchairs, hearing aids. You can really apply for grant funding for anything along those lines. And if you're not sure if it's something that would be covered, we do have information on our website. Again, it's www.achievafamilytrust.org, and it's called our charitable residual program. So I encourage anyone listening to today's webinar, please, take advantage of this program. It's wonderful. Again, we do any camps, recreations, home and car modifications. And if any of you listening are part of a group that would want to hear more information about our residual grant program or even our special needs trusts, we do a lot of different presentations via webinar to different groups really across the state of Pennsylvania. So we'd be happy to come and do a presentation to your group or family members, whoever's interested in learning more about the services provided by Achieva Family Trust. So I just wanted to mention that. And again, thank you all for attending today. We really, really appreciate it.
Yes, thank you so much.
Thanks. Have a great day.